Well, this is Muskegon Pundit, your geezer in a never-ending quest to get health care from the ObamaCare network. This is my second video. I've already explained, this is the plan that I've picked, by the way. I've already explained how I got to this area. This is about as far as anybody you may have ever heard of has gotten. I'm at the enroll button. Sadly, this button, as of today, which would be Friday, November 8th, this button does not yet work, so I can't enroll. But I've been looking this entire quest, well over a month, to find out what the plan specifics were. And I'm not going to go into the details here. This is a plan that's not as good as my old plan. Its real cost of $469.50 is quite a bit higher than my current monthly payment, which is $290. But as I have mentioned before, I'm only going to be paying $16.50 because the federal government has decided that they're going to subsidize my plan. So I'm getting it on sale. And of course, the people who will be subsidizing that plan will be the young people, people 40 and under, who will have to pay back the monies borrowed probably from China or maybe from the Federal Reserve, but they'll have to pay that back. But the good news for me, if I was purely interested in the lowest rates, the good news is that I'm only going to be paying $16.50. Again, I believe it's despicable that we are borrowing money to subsidize these premiums, but that's the law. But as I said, I could not find in the past, I could not find the details. Well, this button was always a dead button. This is the one right above the dead enroll button. I found today that this button does work. And here's what's interesting. I'm going to go down. This is going to be a short video, by the way. You can probably see this, hospital services. And let me tell you, this ought to be chilling because this is not a website mistake. This isn't a bunch of Canadians up north who made an error. This is what the plan is all about. Emergency room care. $250 copay after deductible. All right. 30% coinsurance after deductible in network. Not covered out of network. Interesting. That's emergency room. Inpatient doctor and surgical services, 30% coinsurance after deductible in network, not covered out of network. Inpatient hospital services, you got to wonder who put this one together. In case you don't know what inpatient hospital services are, they explain it to you, like a hospital stay. Okay. Now, this is an interesting one beyond that. A $500 copay per stay. Standard 30% coinsurance after deductible in network, and here they show 100% out of network, which I expect is a mistake, is an error, is probably one of the millions of errors that we will find. But the bigger issue is this: if you have an emergency, it's yourself, it's your children, it's your wife, your husband, your parents, friend, and you don't realize that you have absolutely no insurance if you don't go to the correct in-network hospital, the correct inpatient doctor and surgical services that are in-network. You don't have any insurance. No matter what you're paying monthly, no matter what your deductible is, no matter what your copay is, you have no insurance. If you happen to be driving through Detroit, somebody shoots at you, and you rush your child to the hospital, unless you have fully educated and updated, because this information changes often, updated your information on in-network and out-of-network hospitals, you'll have no insurance. This isn't a mistake, folks. This was built in. This is a great way to reduce the expenses. This is a great way for the President of the United States to go around and say, we're going to reduce healthcare costs. It will be called the Affordable Care Act, the ACA. I imagine if you do have the situation where you take a child or a spouse or parents to a hospital that happens to be out of network around Thanksgiving, let's say you're visiting, maybe you're visiting from out of state, and one of your parents has a heart attack, and you rush them off to the hospital. If you happen to hit that out of network hospital or physician or surgical services or the like, you will have not nearly as much to be thankful for as you had hoped. Perhaps the president will give a nice, I'm sorry if your plan didn't cover your needs, kind of thing, as he has been doing the last couple of days. But Folks, this is a big deal. This isn't an error in an internet website. It's not a design flaw in the site itself. This is a design plan for the most important part of your health care, which of course is the emergency. That's not good. From MuskegonPundit.com, your geezer in search of government health care. I'll be updating as I find more and more little nuggets of nausea.